Okay, and first have you state your name and your profession.
Jennifer Ollie, licensed independent clinical social worker.
Okay, what is a disease, or what is the difference between disease, sickness or illness, and health, and what does it mean to you?
So I would think that I'm sorry, I have to keep this. I'm so sorry.
Okay. The difference between disease, sickness or illness, and health, and is there a difference between these terms?
Well, I would think sickness would mean something that was not chronic. So I would think sickness would mean something that is temporary. I would think of illness in terms of something that was more kind of long term, and I would think of disease as something that was chronic.
Okay, and does it matter to differentiate between these? To make a difference between these three terms?
Well, I think so. Well, just for one thing in particular, a lot of people think about alcoholism as a disease, but in fact, I don't think that there's a lot of research that really indicates it meets kind of formal criteria for disease, but they call it that. And I think that that's interesting because I don't really know what it actually means to have a disease when they use that term for a lot of different things.
So would you say that alcoholism is a sickness or an illness?
I would think alcoholism is an ineffective response to needing to feel peace.
Okay. Moving on to a different question, what do you think about personal health records that people can access and read, where they can actually access your notes that you write and the lab values and basically their medical charts?
So I think it's actually really important for patients to have the right to look at their records. I also think it's really important that clinicians write chart notes with the intent that a patient will actually read the record, and that they should be as professional as possible. So being able to say things in ways that are professionally coined instead of ways that are kind of personally phrased, so that there's always kind of a professional value to it. The other thing I think about chart noting is it needs to be very thorough, and I think it also needs to be professional because you're communicating to another professional in the field, and basically it's their way of getting information during your visit. So it really should be kind of professionally contained.
Okay, and if a patient has access to the personal health record, do you think this could increase the quality of care and the continuity of care, since they could take this health record with them to other health professionals?
I think that it puts the patient in a different position of power. I also think that it helps them to be much more informed. And I think more information and more power is always at the benefit of the patient. I think that that's always good for the patient to have. But I think that if they started receiving most of their medical records, they'd probably be kind of confused. And I wonder how much clarification would kind of take and how that would be managed.
Okay.
Kind of how to process what
so
the
that's
chart
like
notes.
The con of
yeah,
it.
Yeah, that would be the con.
So
of it,
overall,
yes.
do you think having these personal health records are a good idea? Or?
I do think so.
Okay.
I do think so, yes.
Perfect.
I think because also they can dispel, I think there's a lot of medical records that are not accurate anymore, and I think that kind of similar to your credit report, unless you kind of go through it and tease out the things that are no longer accurate, I think it could result in poor clinical or hospital care if they're still operating from old diagnoses.
Oh, but at the same time, if a patient could add to their own personal health record, do you think that could cause problems such as patients not wanting to have things in their record because they don't want people to know about it or they're ashamed of it?
Yes, I do think that that's definitely a possibility, and I think that people, once they read their medical records, feel moved to change some things. But I think if there's something that's really valid in their medical records and they want it changed, it opens up an opportunity for them to discuss it with a clinician.
And then maybe
Adjust it as it goes on.
And provides an opportunity for like teaching, lifestyle changes.
Yeah.
All right. Perfect.
Okay.
Thank you.
Thank you.
You have.